Hi, I am Dr. Ramesh Mohandoss, consultant radiologist and orthopedician, Kauvery Hospital, Chennai. So today I am going to talk about a few common injuries, knee injuries that the cricketers get when they play the game. Mainly the bowlers and the fielders are the one who get the knee injuries in the field. So bowlers, especially the fast bowlers, when they try to bowl the ball, just before releasing the ball, during the stride phase, when they stamp the leg on the ground, they might just twist the knee and they might injure the ligaments or menisci. Because of repeated stride, they might chronically injure the patellar tendon that might lead to patellar tendinosis. The fielders, especially when they chase the ball in the field or when they try to catch a difficult catch, they might twist their leg or they might twist their leg while catching the ball, and that might lead to cruciate ligament injuries or meniscal injuries. Or sometimes if they fall on their knee, they might fracture their kneecap. So these are some of the common injuries around the knee that they might get. The other thing is when they try to catch the ball, they might run fast, and that might strain the hamstrings or quadriceps muscles. So these are some of the injuries that they might get during the sporting activities. How to prevent this? One thing is proper strengthening and training of the quadriceps and hamstring muscles. The other thing is we'll have to play safely, though obviously it is not possible. To some extent we can avoid the injuries by playing safely. The third thing is you should have a proper fitting shoes and orthotic support if required. So this is how we can prevent the injuries. The other thing is, like, once when you have got injured, like you might have swelling, or you might have instability, or you might have a pain, or you might have a locking sensation in your knee. These are all significant symptoms. So if you have those symptoms after the injury, you'll have to do a scanning, MR scan or MRI scanning, to find out what is the cause for that locking or for those symptoms. So if that is there, then if it is significant, then you might have to go and do an arthroscopic repair of the ligaments. So if you don't do that, if you just ignore that, you might get recurrent instability of the knee, locking, and it might limit your activities. Sometimes in due course, you might end up with yearly degeneration of your knee. So take care, don't ignore the injuries, and get it treated if you get one as early as possible. Thank you.